perception and behaviors associated with community-based bovine brucellosis control among only agro-pastoralists in Tanzania. I want to skip the backgrounds, right? Yeah. Then I can skip I mentioned about the cause and the symptoms. Well, the control, if you Google brucellosis and control, I'm sure you will find mass vaccination. And if you're rich, test and slaughter is very effective. Actually, in Japan, in 1973, I think, 1973, we eradicated brucellosis, but we never used vaccines, just test and slaughter, and achieved. And for humans, boiling milk or heating foods are important, but the Maasai, those are people who conduct transhumans, and they don't have fire in the field, and they drink blood. So that's the situation. Objective of this study, so we have limited resources for the disease control in Tanzania. So we wanted to understand what is the best way to control brucellosis with acceptability, economy, and sustainability. And we learned in the previous study that hard level seroprevalence is high in the agro-pastoral areas, and we also learned some risk factors of the brucellosis, again, grazing and abortion. And perception and behaviors associated with brucellosis control is very important for us to understand to achieve this final aim. The material and methods, again, so the study was conducted in this area. This is Kohei University of Agriculture, where some urban area exists, and we travel inside to arrive in the agro-pastoral dry zone. And sampling, we have several objectives, but one of the key objectives was to understand the proper hard level prevalence of the area. So we use this equation and conducted milk ELISA. Yeah, yes, so the calculated sample size were adjusted for the total number of farms in the area, 170. So the 124 samples were collected. And statistical analysis, we tested the risk factors for Brucella seropositivity in cattle, and we also analyzed the factors associated with the willingness to pay for vaccine. Then after univariable analysis, we did generalized linear model with binomial errors and did backwards stepwise simplification. And regarding selling the cows experienced by abortion by farmers, I explained already about the risk of split through this cattle sales. And we thought if we directly ask about this, the farmers wouldn't answer the true figure. So we used item count technique. It's an economic analysis. So this is the technique to employ indirect way of asking question, sensitive question. For example, shoplifting, drug use, homophobia. So when we ask direct question, we expect that nobody answer honestly. So So we ask a set of questions, several questions, then request farmers to please count how many items were correct. Then just tell us the number of the items. I show you the details. So we have two baseline non-relevant questions with the sensitive issue to censor the question, and one direct question. Its question is, I sell out cattle which experienced abortion to cattle market, because as I mentioned, this is the only choice. Then we divide 124 farmers into 41, 41, 42, using baseline questions with sensitive question, and the next baseline question with the key question, and the direct question. And if the proportion of the correct answers by them are high, those using P1, this using ICT is higher than the direct questions, that means they are hiding. Maybe you understand, right? Okay. So the results, those are the geographical characteristics of the high seropositive herds. By the way, this is quite a steep mountain, and we didn't find brucellosis-positive herds, while those other areas are quite mixture with positive and negative herds. And the prevalence 44.4%. Then regarding factors associated with bovine brucellosis, the multivariable analysis only found a preventive factor of using veterinary service. Then, so that means veterinarians is important, yeah, so for us. Then about knowledge, 76% knew the name of the disease, but symptoms and the transmission and the existence about the vaccine, very few people knew about vaccine, although lots of studies were conducted around the area, unfortunately. And the knowledge, poor knowledge, yes. And willingness to pay for vaccines, when we select all cattle, 60% agreed, but selecting new cows, then 90% of farms agreed. Then the factors associated with willingness to pay for vaccination for all cattle, then Maasai people hesitated to agree to pay because it is confounded by actually the larger herd size and their very strong nature of people. But when you select only new calves, Maasai was not a factor, but using veterinary service is an encouraging factor. So the farmers knew about veterinary knowledge more. So ICT results, there was no difference between those P1 and P2, which means then the farmers actually don't hide about selling cows aborted. So they do that without hesitation. And a tribe, when you select Maasai and other tribes for the risky behavior for human infections, and higher proportions were observed for drinking raw milk and raw blood in Maasai, and use of gloves to help delivery was much more higher in the other tribes than Maasai. Discussion. So regular veterinary preventive health measures may reduce the brucellosis prevalence. So the delivery of veterinary service is very important. So education and awareness of the disease are necessary for the disease control. Many farmers were willing to pay for brucella vaccine if if they select only calves, indicating the feasibility of community-based calf vaccination programs. Farmers sold out aborted cows without hesitation, which may have contributed to the maintenance of the disease. On the other hand, however, probably this practice is suppressing the within herd prevalence. Okay, thank you very much for your attention.